Call the member for Balmain.
Thank you, Mr Temporary Speaker. Mr Temporary Speaker, I rise today on behalf of the Greens to address this legislation, and as we've heard, the bill amends the Health Services Act 1987 to restrict the use of the title Paramedic and make it an offence for any person to use the title of Paramedic if they do not hold the required qualifications. It goes on in detail, as we've heard many members express their views about this legislation. Mr Temporary Speaker, I wanted to cut to the chase about two particular issues that are of concern to me. You may know that the Ambulance Service of New South Wales is actually in the electorate of Balmain, and they proudly sit in Rozelle on the site of the former Callan Park institution, and they've been there for many years. We know that supporting paramedics is looking at how we treat and define that role, and we support the elements of this legislation that indicate that required qualifications need to be set out for the paramedics' role. Obviously, we encourage the government to seriously consider the position they take around the ambulance state headquarters in the electorate of Balmain. We're concerned that the decision to move it was either in response to the News Limited campaign or was a bit of a thought bubble, a bit like the Powerhouse Museum moving out to Parramatta as well. It'd be interesting for the Minister just to update the House on where that issue is at. I know that there's a lot of expense around the potential moving of the Ambulance Service of New South Wales, and we've heard a lot of members complain about the ambulance service and complain about issues around its provision. But that state headquarters is the heart, really, of so many elements when it comes to paramedics in this state, and so I'd encourage the Minister to address that issue if the Minister sees fit to do so, to update the House on what's going on with the Ambulance Service of New South Wales, whether or not they will be moving to Parramatta, and if so, when. And of course, it's important because we know the Minister for the Environment and Heritage and the Minister for Planning have been working very constructively, following through on the commitments from the former leader of the coalition, following through on the good, strong tradition the Liberal Party has had, defending and protecting Callan Park against overdevelopment. I mean, wanting that to be taken to its conclusion with this term of government. Of course, the health facilities on that site, in particular the Ambulance Service of New South Wales, are very important to make sure that that is managed in a positive way. Mr Temporary Speaker, can I also ask, and this is just a question of clarification about this issue, will this definition issue have any effect when it comes to insurance? For example, I know a lot of sporting clubs, they use different types of people, first aid officers, paramedics and others to be able to assist in sporting events and so on. I just wonder if the government's put their mind to any potential unintended consequences around this legislation about what this framing of a paramedic actually means. Are there any implications for insurance or any other matters that this House should be aware of? I note that it doesn't mention it particularly in the briefing note, but it's something that I think that it would be worthwhile to share with the House if the Department and Minister had come to that. Can I just conclude by thanking those staff that have been involved in the development of this legislation. I notice when we looked at the New South Wales Ministry of Health has consulted with a very broad range of agencies. I know there's a lot of support for this legislation. We will not, of course, be opposing this legislation. And we want to make sure that paramedics, as one of the most respected professions in this state, is protected, is managed and regulated in a way that promotes the health of the residents of New South Wales, but also supports the professionalism, the ethical nature and the sheer determination that so many paramedics have to look after people and care for people here. Qualifications and training are important, and we do need to have a clear definition that identifies the difference between highly trained and skilled paramedics and other important first aiders and first responder roles. We welcome the fact that these elements will be grandfathered. I think it's important to recognise that those people who have been working for many years who do not hold the qualifications, the training or experience are allowed to continue to call themselves a paramedic. So, Mr Temporary Speaker, can I close by acknowledging the important decisions that this House makes, and this, while it might seem like a small symbolic one, actually does make a significant difference. And I again request that the Minister for Health outline to the House how paramedics will be dealt with the move of the Ambulance Service of New South Wales, and whether there are any implications around insurance and other areas for this legislative change. Thank you, Mr.
Question
Speaker.
is.